This is the RheumNow Weekend Review. It's the 30th of June, 2017. I'm Jack Cush, Executive Editor of RheumNow.com. I'm coming to you from the LaGuardia Airport Food Court. What better way to do a recording? This week on RheumNow, a number of interesting items. ACE levels. I don't know if you consider using ACE levels diagnostically. We always talk about them. We certainly know that ACE levels are correlated well with pulmonary involvement in patients with sarcoidosis, but I've encountered some patients recently with very high ACE levels, and researching the subject come up with a few citations that show that high ACE levels are not unique to sarcoidosis. Certainly you can have sarcoidosis, very active sarcoidosis, and have normal ACE levels, including sarcoidosis with lung involvement. But very high levels can also be seen in other granulomatous disorders, in lymphoma, in cancer, in hyperparathyroidism, even Crohn's disease and hepatitis B. So there's a wide differential diagnosis with high ACE levels. A study of 200 patients with rheumatoid arthritis showed that carotid plaques were seen in over half the patients, and that, interestingly, plaque was correlated with ACPA. Again, the idea that rheumatoid arthritis is uniquely primed to lead to cardiovascular disease is something that's probably much more obvious than just disease activity. A national study looked at ER visits for shingles and showed that in the pre-Zostavax era, prior to 2007, there was a sort of steady incline, but that rate dropped significantly, not in younger groups, but in the older age group, the group that would likely get the shingles vaccine. There was a significant drop nationwide in ER visits for Zoster. A nice study, I think, in Annals of Internal Medicine looked at the comparative roles of yoga and physical therapy and other modalities in treating chronic low back pain, showing that yoga is actually equal to physical therapy in those outcomes. Whole genome sequencing is popping up here and there, and it seems to be a promising tool to identify patients who have really strange disorders, undiagnosed disorders. And a study in Annals looked at 100 patients and looked at the utility of whole genome sequencing and showed that in only about 20% would whole genome sequencing reveal a gene that may be associated with a disorder. Unfortunately, the number of those patients who actually had the disorder was even lower, suggesting that this is probably not yet for prime time test in patients who have undiagnosed disorders. Again, back to sarcoidosis, there is a strange study, but nonetheless, study looked at the risk of fracture with sarcoidosis. I don't know why one would assume there's a risk of fracture. And it showed, guess what? No risk of fracture, unless, of course, you're on steroids, and then the risk is related to steroids. A recent study looked at Americans and Europeans and showed that Americans sleep on average 6.5 hours a night. Europeans do a little bit better, 7 hours per night, but that historically, we're sleeping about an hour and a half less than our grandparents. This is a strong message, I think, for many of us. We should be counseling our patients on proper sleep, because sleep has been associated with many bad outcomes: diabetes, obesity, cardiovascular disease. A meta-analysis of 35 studies looked at nonsteroidals in back pain, and guess what? These meta-analyses for common drugs that we commonly use in low back pain don't ever fare very well, and this one didn't either. It did show that they have a modest benefit, but nonetheless a 2.5-fold increased risk of GI toxicity. The FDA has recently approved Rituxan subcutaneously for use in lymphoma and CLL, but is not yet approved for use in rheumatoid arthritis and other rheumatic disorders. But nonetheless, it's an interesting advance. It can be given subcutaneously. It's called Rituxan Hycela, like the train, but nonetheless is out there and now available for use. A study of 100 ANAs who had pair testing, ANAs done by multiple methods, showed that the agreement between pair testing is actually not very good. It's only about 18 to 42%. They're using different criteria. Now, the patients who actually had an ANA-associated connective tissue disease, there was even less agreement. So again, there's a lot of variability. With the increased sensitivity of ANAs, we have a loss of specificity. Interesting report about why maybe osteoarthritis patients may preferentially affect women. Researchers looked at synovial fluid exomes and looked at specifically microRNA from those exome analyses, and showed there was a major discrepancy between men and women with regard to the types and numbers of microRNAs that were upregulated and downregulated, and that some of this activity was related to estrogen. And then more importantly, they showed that if you use aromatase inhibitors, you can actually reduce the amount of those microRNAs in women that may be associated with osteoarthritis. Maybe this is why there's more osteoarthritis in women. A small review looked at breastfeeding amongst lupus patients who've delivered, and not surprisingly, breastfeeding is down in patients with lupus. The number who elected to not initiate breastfeeding was higher in lupus, about 20% versus 6% in non-lupus control. More importantly, the duration of breastfeeding was also lower in patients with lupus. And a last report coming from EULAR 2017 was about IV golimumab. This was a very surprising trial. It showed that golimumab in the Go Vibrant study, 480 patients given 2 milligrams per kilogram of Simponi versus a placebo, the rates were really stunning. At week 14, 75% versus 22%. A very important result and a nice result for golimumab. That's it for this week on RheumNow.com. Go to this website, see the citations. Next week we're on vacation. Enjoy the holidays. Take care.